was on a Tuesday afternoon that I came here to an outreach program at Point Washington United Methodist Church. And every Tuesday there was one child that would come in, and he was one of those children that would win your heart. He was disruptive and cute and funny, and he was wonderful, and he reminded me of my own boys. And he had one glaring problem, was his teeth. He had 3 sets of teeth. I thought someone should help that child. And finally it occurred to me that that someone had to be me. As I investigated it and went further, I became convinced that there were more children than just Tyler. And Tyler did get the help he needed. A local orthodontist fitted Tyler with his braces. His grades went up, his self-esteem went up, his turnaround was amazing. And lo and behold, he had a little brother that needed help. And then there was a cousin, and it just went on. And with that, that was the seed. We started the Children's Volunteer Health Network.
People do wonder, why are there so many children out there who do not have access to medical when the services are out there? We received a call yesterday from a mother whose daughter is on Medicaid, but her cost per share per month is over $1,300 a month. This means that she has to take her child to the doctor or the dentist, incur over $1,300 in bills before Medicaid will pick up that cost. They have to wait until their children get so ill that they take them to the emergency room.
I never knew that a abscessed tooth could kill somebody, but it can. Trying to take my daughter to the dentist, a couple dentists actually in the area, and unfortunately it was unaffordable for my family, being uninsured. My daughter, because of an abscessed tooth, we had, of course, had it pulled out. Several weeks later, we started with fever. And this infection from the tooth went to her heart. They called it microvalve prolapse. It's pretty common in young women, from what I understand. This can kill people.
Well, when I was in the hospital, it definitely was very scary, but at the same time, I didn't really know how serious everything was. I didn't really know how bad it was actually till after the surgery.
If it wasn't for the Children's Volunteer Health Network, my daughter wouldn't be sitting here next to me today.
I've been fortunate enough to be able to work with the Children's Volunteer Health Network for the past 2 or 3 years now. We see about 30 kids a month, and we do it because we have a real desire to help children that have a need. These people don't always have insurance. Their children need medical attention just as much as anyone else does, and we're pleased and proud to be able to do that.
I moved over here with my mom because my dad had just found out that he had cancer. And he didn't want me to go through that with him, to see him that way. I've always been able to talk to Zach whenever I needed to. I could just call him up and just talk about it. CVHN and Zach and all has made it a lot easier to go through this than just, going through it by yourself.
I've learned a lot from him. He's gone through a heck of a lot, being a kid, and I don't know many adults that could go through what he's gone through and come out with a smile on his face.
Everybody's telling me that I'm going to grow up without a father and it's going to change me. Well, and then other people tell me that I can be whatever I want to be.
I think the sky's the limit for him. He will learn from the tough times that he's gone through, and he'll build on that, and he'll turn it into a positive thing no matter what happens to him. But I know he's got a bright future ahead of him.
CVHN is a good group. It has a lot of caring people in it. It's been great.
We went to 331 Cafe and asked them if they would have a hurricane party. And after that evening, we left with $37,000, our seed money. So the community absolutely supported the beginning of this project and have supported it ever since then.
The mentoring program that we started is called Helping Hands and Hearts. I started mentoring Devin when she was 14 years old. She was one of our first major dental cases through CVHN, and she now has not only looks to me to be her mentor, but she spends lots of time with myself and my husband as well, and so she's really getting that family kind of environment. She might not have the opportunity to go to college, and she's a very smart girl. She gets great grades, so we decided to start a scholarship fund.
So I'd taken her to her regular dentist, and she said that she needed braces.
My jaws would lock up, and my bottom teeth are normally in front of my top teeth. They'd like get stuck behind my top teeth, and I have to like force it out, and it hurt.
The realtors came together at their meeting and decided to donate the money for their Christmas parties to do her braces. When Char called me and told me, I started crying. These people that didn't even know my daughter were willing to give up their parties to fix her mouth.
I'd really like to thank CVHN for helping me get my mouth better.
When you see some of these children that are being helped by CVHN, and you see these physicians and healthcare professionals that are doing this stuff out of the goodness of their heart, it just it's a blessing. It's that important that we get people not only participating as volunteers, but we need people participating financially. Realtors are the lifeblood of the local economy, just like housing is. Realtors are professional people that are making a difference in the lives in their communities.
We really have been blessed in our industry as a realtor. And in the community, as we do this outreach program, they get to see us as community partners. Anybody can do it, any community can do it. We're an area of volunteers. I would like to see many of the communities take care of their children in this manner.